Good afternoon from Sweden and India, and welcome to this discussion called Redesigning Indian Society in a post-COVID-19 world. This is part 4 of a webinar series called Corona Pandemic and Society, which has been organized by the School of Business, Economics and Law in Gothenburg University, Sweden. I have with me a number of panelists, very well-renowned panelists, remarkably successful professionals, highly regarded by their peers, both national and international. But in the interest of time, I will not recount their achievements, but give a brief introduction to each of them. Slightly larger bios were given out when the announcements were released by the university. For those of you who are interested, can read them up. First, I have Nagma Mullah. Nagma, if you could please wave your hand so that the audience knows you. Nagma Mullah is the Chief Operating Officer and board member of Edelweiss Foundation, the philanthropic initiative of Edelweiss Group. Then I have Luis Miranda, who has been responsible for setting up 2 highly successful companies, HDFC, which is the largest private sector bank in India, as well as IDFC Private Equity. Currently, he is chairman, Manipal Cigna Health Insurance, and a co-founder of the Indian School of Public Policy. Dipankar Gupta is a professor of sociology and an author. I describe him as an author not only for the many original research work that have been published as books, but because he has also published, don't be surprised, he has also published a mystery novel and writes fantastic limericks in his spare time, of which he now has a lot given the lockdown in India. I am Shubhashis Gangopadhyay, your host. I am Research Director at India Development Foundation, the Dean of the Indian School of Public Policy, and a visiting professor at the University of Gothenburg. As a host, I take my job seriously. So I will say as little as possible and instead facilitate an interesting discussion, first among the panelists, and then between the panelists and you, the audience. So please write in your questions on the chat box. The questions will be visible to me and the panelists only. Indeed, you're not visible to them, though they are aware of your presence. Here is an advanced apology. Not all your questions may be answered by the panelists, largely because time is limited, but also in a very small way because I may be biased towards some of the questions more than the others. Finally, before we begin the discussion, the webinar is being recorded and will be put out so that more people can watch it later. Having said all of that, let me now start with the discussion. I'm going to begin with Dipankar. Dipankar, given the things that have been going on lately, the work from home, social distancing, immense pressure on weak health infrastructure in emerging economies like ours, how do you think our society will respond to these experiences?
Well, it's still too early in the day to be definitive about it, but I think that we can look at our social responses in terms of the everyday quotidian response with family and friends, which we call generally social, the political and the economic. In the social realm, purely social realm, I think there's a difference to be made between the middle class upwards and those who are poorer. And the world, the post-COVID world is very different in both these sections. In the middle class world, I find that most people are more or less reconciled to what's going on and have found their niche. They have been able to get home delivery done. They have some relations with domestics, which are ongoing, and otherwise are not seriously threatened by jobs or for want of money. On the other hand, we have those who are the unemployed, now unemployed because they were employed till the lockdown happened. And for them, the world is very different. And this difference can only be captured through what we've heard on television, read the newspapers and photographs and so on and so forth, or people milling around the highway hoping to get home. But the more important thing is this, that in some ways I feel that the middle class feel rather secure and comfortable in keeping the poorer people away. And there is a lot of emphasis given to the RWAs, at least in Delhi, to make sure that the rabble don't enter the gated colonies.
Just
And
1 minute, Pankaj. Just 1 minute, Pankaj. So RWA are resident welfare associations.
That's right. And almost every neighborhood has an RWA. All housing societies have RWAs. And the general pressure on RWAs, if I'm informed correctly, is to make sure that they are protected from the outside world. Sometimes, of course, they carry it to some absurd limits. For example, the RWA in our area doesn't even allow us to go for walks, and even if we maintain social distancing and so forth. So in some ways, I find that they sort of are giving into their age-old paranoia regarding the others, the poor people outside there who are milling around, the rabble, and to make sure that they don't enter our lives, especially at a time like this when we could fall seriously ill on account of them. Forgetting, of course, that the whole COVID business started with people like us. We were the ones who brought it to India. But now the blame seems to be on them. And because you cannot have social distancing amongst poor people, therefore the fear amongst people in the middle classes is heightened even further. Now, when you go to the economic aspect, and this is something which is so obvious, it hardly needs to be emphasized, but the emphasis that we have put economically on medium, small, and micro enterprises is really the bane of our economic woes. Our problems stem from there, because that is where all the almost illegal and nefarious practices take place in the entrepreneurial world in our country. Informal labor, part-time labor, kept on a tight leash, and all of that. And these are the people who have been now ousted. It's very hard to say their numbers, but the numbers can go up to 50 million, maybe even more, who knows. But those are the people out in the streets. Now, these people feel extremely alienated. Imagine, they want to go back to their village, the very place they were so keen to get out of. That is what we must understand. They're not village lovers. They don't have any romantic idea of the bucolic village. But they left the village hoping to have a better life in the slum, which is a hopeful place, rather than the hopeless, dead-end village. And today they want to go back to the village. So you can imagine the kind of emotional somersault that they've all gone through and are still going through. So very often when we say that they're going back to the village because they're looking for security and so on and so forth, that is partially true. But remember also how rudely they've been rebuffed by the city that they should want to go back to the place, the very place they were so anxious to get out from in the past. And that is why I think for the first time around, they will really be facing upfront tensions in terms of kinship, family, joint family, etc., of the kind that they never faced earlier in the villages because there was always an escape route. Now that they're coming back, all these earlier unresolved questions will become active in their everyday interactions. Politically, I feel that this is the time for the leaders to rule. Because if you're going on TV, you don't need all the foot soldiers around. Now you just need one leader, or maybe two at the most, or maybe 1.5, who will be on TV all the time, everywhere, in full display. Which is why today I think you will see less and less of the number 3 and number 4 in the party hierarchy. You'll always see the number 1, and maybe number 1, the most important party. So this is the way in which I think the future will also work out in terms of television presentation of political persona and ideologies. You will not have large rallies with millions or thousands of people, because not necessarily anymore. You just need one person everywhere, and the television will do that for you. Okay?
Yeah, but I do want to ask you one more thing. Now, one of the things that were quite evident in this entire experience is that some of our countries have very weak health infrastructure. How is that going to change now? The organization of our health services.
That is not going to change, because we have not yet put the whole idea of welfare, health, medical care, or what is the word for it? Healthcare systems. We have not put that on the table. It's not there. What we have at best is insurance of this kind or that kind. We don't have healthcare on the table like it should be. People don't think about it. And the moment you say this thing about healthcare, the first thing that comes up is we are too poor, we are too many, and therefore it's shot down. I've been talking about healthcare for God knows how many decades, and every time, and you've been talking about it too, and every time this is the most common response. we are very poor. They don't realize that countries like Sweden, where our friends are sitting, Sweden was one of the poorest countries of Europe, poorest and perhaps the most corrupt country of Europe. And look what happened to Sweden. It's now a picture book in terms of health welfare. And they didn't do it when they were rich. They began this process when they were poor. In fact, almost every European country, perhaps with the exception of Finland, began this process when they were the poorest. This is also true of Canada. Canada embarked upon the health systems of the kind that we are talking about, the public health system, when they were the poorest during the Second World War. And that was Saskatchewan. So to say that we have to be rich before we can do it is not the answer. We talked about Basque Country quite often. Basque Country again was the poorest part of Europe, of Spain. And Basque Country today is actually a model of a developed country. And they began on the health system when Franco died in 1980, when the unemployment rate was 40%. It is at that time they started the health system, and look where they are now. So you don't start health system when you're rich, you start health system in order to become rich.
Thank you, Dipankar. Now I'll move to Louis. Louis, as somebody who has been involved with businesses both globally and especially in India, what are your reading of how the businesses are going to change given this experience?
Thanks, Shubhashis, for this opportunity. India has been in recent times the fastest growing large economy, and we're facing a huge slowdown. So GDP growth, which used to be in the 6% and above levels, we're now talking about -4 to -7%. But before we get into that, I'd like to look at some of the comparative data to put things in perspective for you in Sweden, looking at Sweden and India. The population of Sweden.
By the way, this is going all over the world, so not just Sweden.
Okay, sure. Okay, but the population of Sweden is 10 million. India is 1.3 billion. The GDP of Sweden is $500 billion. India is $2.7 trillion. The GDP per capita is $55,000 in Sweden. It's $2,000 in India. Let's look at the COVID deaths. We've had 366.2 deaths per million till yesterday in Sweden. In India, it's 2.29. The total number of COVID deaths, though, is in Sweden is 3,679, and India is around the same, 3,163. To put things in perspective again, if India had the same COVID death per million rate, we'd have 500,000 people dead in India by now. Just to put things in perspective as we look at what the strategy that Sweden has taken about no shutdown versus India where we've had a lockdown. So one of the things in India, when you look at it, is the low number of deaths. We've had 96,000. It's rising, but the rate increase is relatively stable. This curve hasn't flattened yet, but we've had surprisingly low number of deaths. But we've had a significant and severe lockdown, which is a challenge to the economy. We've been locked down from March 25th, so it's nearly 2 months. And it's a challenge to the economy because the supply chain has been broken, labor access, bank funding, managing of receivables, demand slowdown. All of this is impacting it. And the big challenge we're now facing is how do we lift the lockdown? Because a vaccine is 12 to 18 months away. The recovery is going to take at least 2 years. And therefore, we need to get a lot of fiscal and monetary stimulus to help us along the way. What's been most visible is what Dipankar just talked about, which is the problem with the migrants. We have no idea really what the cost to the economy is about this huge migration that's happened. And I guess we'll talk about that later. But let's look at the economy. This is the time, as Dipankar said, for leadership to shine and for changes to happen. Unfortunately, we haven't seen enough of that. There have been some reform measures, for example, in agriculture, where we've seen a lot of steps being taken to make it a more market-based economy. We hopefully will see a lot more monetization of government assets, state-owned enterprises being sold, land being monetized, etc. We're seeing a lot of changes in labor laws. What's been happened so far has not been the right thing, which is basically just scrapping laws in certain states. And Shubhashis has written about that today. But I think there are going to be some measures which are needed to protect labor at the same time, make it flexible and enable the migrants to be able to come back. Businesses are cost cutting tremendously. But the biggest disappointment from the government has been the fiscal support. A lot of measures were talked about, but in reality, the government wasn't really doing much. They were just either paying people what was due to them or deferring and not waiving taxes. We expect the economy to shrink by 5%, which is actually a strange time because this is also the time when we can look at attracting foreign investment to India, given all the challenges that people are having with China, etc. But I think we're going to see, we need to really do a lot more to attract that foreign investment. Dipankar did talk about the medium and small size industries. A lot of them are facing bankruptcy today also, which makes it more difficult for a lot of the informal sector to come back. And I think about half of the total labor force in India is actually involved in more than half is involved in the informal sector. So what we call the MSME, the medium and small scale industries, we're seeing them get credit guarantees and money from the government. And let's see how that pans out. And we expect to see, as I think in a lot of other places, right from 100 years back when the Great Depression happened, we'll see public work programs taking place. As a result of this, we're going to see reduced expenditure by the government and increased disinvestment, more borrowing by the government, and monetization. That's my summary of what we expect to see.
I just want one clarification from you, Louis. You said that you talked about the death rates, right, in Sweden and India. But in many of these OECD countries, not just Sweden, as contrasted with India, is the fact that they have a much larger set of older people than we do, right? And given that younger people have appeared to be more resilient to the virus, could that be the reason why they have such higher death rates?
Sure. I mean, clearly, when we look at certain countries, like Sweden has been taking a more open sort of view about this. And, and I think one of your ministers did talk about the fact that we're going to protect only the old and the frail. And basically, herd immunity will help a lot of other people. And that, more than 50% eventually we'd see would have contacted the disease at some stage or the other. So, but with that in place, yes, I think in Europe, you're seeing one of the problems has been old age. In India, though, we expect to see a lot more people getting hit and suffering because we don't have the luxury of living in large apartments. You'll see 7, 8 people, and I presume Nagma will talk more about that, living in an apartment which is 10 feet by 10 feet. And, in that closed environment and houses next to each other, the fact that we don't have more cases and more deaths is something that people are still grappling to figure answers for.
Okay, on that note, Nagma, you have been asked by Louis to respond.
No, thank you very much. And yes, I will. This has been an incredible 2 months for the development sector in India because it has demanded both citizen participation as well as civil society organization participation like few things have had before. The lockdown was, like Louis rightly said, pretty brutal, but maybe needed. But what really hurt was the very low prep time that was given to the public to stock themselves up or to decide where they want to spend their in, and that gave rise to an incredible amount of panic. For those who could just pack up and leave, they did. But for the others, there was also an expectation that within 10 days or 15 days, the first lockdown, we will be able to move back home. There are some things, and I will go to the negatives of what happened immediately, is clearly the India is divided now into 2 societies. Very clearly, those who can protect themselves, who can afford social distancing and who can afford stocking up and health care in some way or the other, and then the rest of India that has really been left with no alternative ways to provide for themselves. And so landlords throwing people out of homes, employers not paying salaries, and daily wages having nowhere to go really happened. The first crisis that hit within a very 3-4 days was the crisis of food and starvation. and where organizations really adapted phenomenally quickly and used their networks to really reach out and start distributing rations in small quantities in the beginning. And appeals started going out to civil society. And here is where I have to admire the way we responded. There was an overwhelming generosity of people who stepped up and started funding rations and supply of food and so forth. Quickly what happened, this also escalated. There was a second problem that I saw at that time was the migration movement, where see, most of the people who were receiving this relief were people who were hard, or people who worked really hard so that they do not have to beg, who were saving up to provide for education of their families, and receiving charity was not what they had ever wanted to do. And also the desire to be home was overwhelming, and there was no money really. So the walk started, the migrant walk. In the first phase, almost 90 million people began walking home. 50 to 90 million people were on the roads, on highways, traveling, walking 100 to 800 kilometers on an average. And that again was something that we had not envisaged. The governments had not prepared. They had not thought that this will be the fallout of this crisis. On a health aspect, what this did is it took the virus from urban areas into places which were so far secure and were self-sustained, were cautiously watching everything, but were not affected by virus. And so the spread also was magnified along with it. So we have these two, employment and food crisis, that hit us very, very hard within the first 3 to 4 weeks of the lockdown being implemented. Like I said, the bad was what happened to the population, how they were being bereft, but a lot of happened, which is generosity was overwhelming. Organizations tested their resilience and they were at it. Within 4 or 5 weeks, what I've observed and my organization observed is that there is now a fatigue that is there within the whole system of, how long will this go and when will government step up? The government has made some very, very progressive announcements. Even recently, the whole focus of the Prime Minister on local governance and local support for local issues is a very proactive move. But the chaos and the trouble that we have on our hand is again like unprecedented. Where I see this going forward is that we have a crisis of migrants that have either moved home or are moving home. There is, like the banker correctly said, a lot of grief that the cities have disowned us. So there is also a bit of an anger that we will not come back. Now, we are hearing two narratives continuously. One where people have sworn that they will never come back, and the other where people are just, they have no option back home. They're going to come back. We're also understanding the estimate number of people that won't come back will be around 20% of that who have reached home. So almost 20% will not come back. And why do we see that happening? Is because rural India has also kind of stepped up. At a local level, whether it's the panchayats or whether it's local governing bodies, isolating and taking care of one's own is happening in a lot of places. Again, there are a lot of places where people are being left to fend for themselves. But I think this will settle down as time goes by, where rural India will have to work with its rural population. They are now going to have to grapple with the virus because so many migrants have also moved on. Over the last weekend, there was a second wave of migrants walking back. So today, as on today, we estimate almost 140 million people have walked back. They've not all reached. So we are also beginning to see a crisis of deaths on highways and young children being orphaned on highways. We've not even begun to address the issues of what happens with these very, very young children that now have no social support system. We've not started to address the issues of violence against women that has completely overwhelmed the system. Women have nowhere to go, not in India, but across the world. Violence has escalated by 100 to 300% in developed and in underdeveloped countries, because the perpetrator and the victim are never really separated anymore. In India, what has added to that problem is that women-related grievances are not now listed as emergencies. So if a woman will call and ask for help, she will be asked to take care of herself for some time because the police is very busy. This again is an unaddressed concern as of now, even though there's beginnings of noise around it. The third issue that I worry about immensely is the issue of mental health, which we are completely unprepared for, because there's just too much of depression, there's too much of depravity that's carrying on for day to day. People who are barely managing through meager savings are now slipping under below poverty line. So our poor are going to get poorer, and the middle class is going to get poor. And we have to craft a way to figure this out. So with all the bad news, I will pause and later.
Thank you. Thank you. So we have sort of gone over what we have experienced in this crisis, right? And how our fault lines have really manifested themselves in some very, very grave situations for certain sections of the people, because Dipankar quite rightly distinguished between two groups in the country. One which had, faced some problems, right? Because they can't go out and see movies and stuff like that or go to restaurants. But on the whole, continued with their activities otherwise, whereas there is another group which had a sea change in the way they existed, or they even stopped existing. So what I would want, first, Dipankar, since you spoke before the other two, so do you have anything to add or disagree or emphasize what the other two have said?
No, in fact, I don't have. This is rather surprising, but I agree with. Yeah, but I think that we're more or less on the same wavelength. The only thing is that I am not quite sanguine about the kind of government interventions that are being planned, because in my view, the big picture is not going to change with supply-demand economics. And we have to look at the way in which labor and entrepreneurs interact. And this interaction, in my view, is a central feature of if you want to change, you want to go ahead, you want to move, and we don't want a repetition of what we are seeing today, it cannot be done by either giving more money into people's pockets or by making interest easier. These are, of course, they have to be done. They're first aid. These are band-aids. I mean, when you fall sick, you have to go to a doctor. That's fine. But what do you do after that? And in order to be able to see the larger scape beyond the present, we have to look at the ways in which labor and enterprise interact. We have to ask ourselves the question of why is it for 6-7 decades now and more, we have allowed informal labor to grow at this rapid rate. We have to ask this question first and foremost. And we always get deflected into quote unquote economic questions without asking this simple question of relations between people. The second thing which I liked about what Nagma said about village, you see, the thing is really is this, that there are fortunately for us, half the MSMEs are rural. If that had not been the case, you can imagine how many more there would have been on the highways. Half the MSME is rural, which is why we also say that villages are not really rural anymore, because so many villages actually house these outfits and enterprises. But what is happening right now is that most of the returnees are men. There are very few women in that group. Most of them are men. There are a few women, there are a few children, but the bulk are men. And the villages they've come from, the households they've left behind, in their absence, are being run by women. They're women-headed households. Today, an estimate says that over 1/3 of rural households are women-headed, not because of feminism, but because they've just moved in to fill in the blanks. The men were away. Now they're going to come back. What kind of tensions will you face now? Some of my friends have told me that women-headed houses and villages, they find that children are better educated. The health status is better. Now, when men return, will they reclaim their position? Will their fathers say, yes, my son is back, wife, get out? Or what will happen? I think there's also a social churn that will happen in the villages, and we should watch out for that. I think that is where, when Nagma talked about women's position in society, I think this is going to bring about a fresh wrinkle of the kind that we had not experienced in the recent past. Thank you.
Dipankar, there is a question that has come in which I want to address to you, given what you said just and what Nagma said. The question asked is that can we call this the fact that 20% have announced that they're not going to come back to the cities from their villages? Ruralization is the term that has been used by one of the questioners, right? So
I think what might happen, what might happen is maybe ruralization is a bit extreme, but what might happen, and there's a good chance of that, that is many more MSMEs may be set up in rural India. That might happen because there is a reluctance to go to the city. Perhaps many villages will now think that that slum they were thinking of the other side of the rainbow is not really without its insecurities. They may want to stay back. Remember also that a large number of men move from village to village in search of work, even in today's India. That tendency might be heightened by this, but I don't think that over the long term, many villages will stay back. Many of them will begin to come back to the cities because, you know, hunger tugs at your stomach more than your heart tugs at other strings.
Lewis, do you think there is a possibility that there will be more MSMEs opening up and more businesses probably moving rather than making labor move? You're muted, Lewis. You're muted.
Sorry. I'm not sure how much of labor will stay back in the village because a lot of them came to the cities for economic reasons, as we've talked about. Nagma did talk about a 20% may stay back. A couple of things to bear in mind. A lot of the rural economy also survived because of the remittances that came from urban people back to their villages. That's going to stop if they're back in the village. That remittance is not going to come. So that spending power will not be over there. Will MSMEs move across over there? I don't know. It's too short. At the moment, a lot of MSMEs are actually, stuck with like the glare of a headlight on their faces. They're paralyzed because they do not know what to do. The government very wisely says, as part of our magnanimous rehabilitation package and stimulus package, we will pay you the overdues that we owe you, which I think is really ridiculous. Because if you owe somebody money and you offer to pay them back, that's not aid. That's sort of, just repayment of a liability that you had to give. So, and then they're finding it difficult to get bank financing. So while there's been announcements about credit to the MSME sector, etc., it's still a bit early. I found Dipankar's point about the relationship between entrepreneurs and labor to be something which is very interesting. I've never sort of seen it more as a social issue. I've seen it more as an economic sort of, parts of an economy. But to see that relationship, I think is important. And I think it's really a fault line of the labor laws. So labor laws were what they are. I think we give too bad a rap for labor laws in India. I've been involved with businesses in Australia, in Sri Lanka, and I find the labor laws to be a lot more restrictive over there. But we found a way to get around it, which is through this informal sector, non-permanent labor. And I think we need to, instead of saying we scrap all labor laws, we've got to come up with good labor laws. Also, I want to come back to the point that Nagma was talking about, the mental health challenge. So one of the NGOs that I'm involved with was, was really focusing a lot on understanding the challenge women face and talking to a lot of them. And they were so grateful that someone actually called up them to talk because they're struggling, stuck in a house 10 by 10 and, and getting beaten up by a husband because he's extremely frustrated. So they said, let's talk to the men. They talked to about 360 men. And it's interesting to see how some of those men actually broke down because they're also under a tremendous strain. Because earlier they were the heroes because they were the breadwinners in the family. Now they're not doing that. They're concerned about the future. So I think we're going to see a lot of new social changes taking place in India. And I think women are going to be the ones who are going to be hit more. Because if you have less money in the family, then there's going to be an increased focus on spending money on the boy child as opposed to the girl child. Or if the grandparent is not alive, then the mother has to stay back to look after the house. So she comes out of the labor force. I think we're going to see a lot of things which, as you know, Subhash, you keep talking about unintended consequences happening over here.
In fact, I'm excited by the last thing that you said in terms of unintended consequences. But there are some questions that are coming in. Please put your questions on the chat box, and I will take them up, not one by one, but some by some. But in the meantime, please remember that, please make your questions crisp, because I'm also trying to follow the discussion and reading. So if you keep your questions crisp, I'm sure it is easier for me to pick them up. So in that context, there is one question that I want to throw back to the panelists, and maybe I'll start with Nagma, because one of the things that I forget whether it was Lewis or Dipankar who mentioned the fact, I think it was Lewis, that working from home is a problem in many parts of the country. For example, in Mumbai, people stay in much smaller places than they stay in Delhi, right? It's much more congested in Mumbai. So work from home is not a possibility for most people. So how is that going to affect the life? You know, you talked about the gender violence, right? It is already showing up indeed. But also this, you know, life inside the house where you're 24 hours when working from home. Where do you get that space?
Yes, this is a problem, and in fact, the cluster that Lewis was referring to actually has 10 people living in 10 feet by 10 feet confined spaces. But we are also talking about different problems. So when we're talking about the average Indian, there are many average Indians right now. Someone who's working in a two-bedroom hall kitchen in a blue-collar job and a white-collar job, very different experiences. Some will have to step out and travel, and some will have to accommodate between their homes. But coming to the aspect of violence and what it does to the woman of the house, whether adding to her burden, addressing office-related issues as well as home-related issues, the biggest problem that has erupted is the lack of her availability to ask for help. See, she's cut off from her social sphere. She's cut off from any kind of, police intervention, any kind of legal aid that will come to her mind, to her rescue. At this time, and I'm sure it's already begun, and CORO, the NGO that Lewis was talking about, is one of the first kinds to get this out. Women will start bonding with each other, calling each other for help instead of leaning onto the police network. I hope that is very, that is a short-term problem that we have, and that it reasonableizes as the time goes by. But the issues around safety of men, safety of women, ability of women to work in confined spaces, ability of women to have agency, to demand what they think should happen, has completely been compromised, and years of work has been washed away. And we have to understand that when we're doing dipstick surveys across places, the first concern that boys have is, when will we go out? And I hope our school is not disturbed. But the first concern that a girl has is, I don't think I'll be able to go back to school again. These are extremely different experiences from same homes, which having same, because when there is pressure in a social setup, the gender that gets compromised is the woman. It's all hard-earned agency which is getting eradicated, and we're going to have to put in a lot of collective effort to ensure that that agency comes back. But it's going to be a longer haul. There is no quick fix on this.
But then let me ask the following question: that given digitalization, right, that is taking place in the education sphere, I'm not talking of schools, because there is a reason why children should be physically together, right? But at least in higher education, the digitalization could lead to a reduction in the cost and allow the girl to get educated from home.
Yes, of course. See, there's two things when we are talking about issues, especially around women. One is the availability of resources, but the second is recognizing that there is a problem. In most homes of marginal incomes or marginalized people, the need for a girl to study is an afterthought. it is a right that has been hard earned. A boy must go to school, and what Lewis was referring to earlier about the pressures of being a man also, that you must go and earn, and you must go through schooling. Women have a different pressure where the recognition that she needs to be schooled is not there. So if there is pressure within the house, she better take care of the kitchen. She better become the caregiver for aged, younger population as well as the men in the house, while the men in the house get opportunity to go out and earn and learn. And that is the social construct that gets developed when families are under immense pressure. Lewis, you want to say something?
Yes,
Sure,
please,
this
Lewis.
is in addition to, this is a follow-up to your question, Shubhashis, about, will digitization help girls study from home? My wife is involved with an organization called Seeds of Awareness, and they're training trainers from some of these communities to be to teach sex education, etc., to other kids. And the problem they're having as they're going digital is that, one, bandwidth is not good enough in a lot of these slum areas. Two, there's not enough privacy. So there's a lot of noise where they're studying. So for them to find that secure space, like I can sit in this house and be, free without any noise, etc., they don't have that luxury. So that is a challenge. While theoretically it looks like it will help them, I think there are a lot of infrastructure challenges that they have.
The point you made, I want to go to Dipankar. Yes, Dipankar, because one of the things that does come up with digitalization is that this divide actually gets widened between the haves and the have-nots, especially when it comes to the infrastructure. Yes, Dipankar.
I absolutely agree with Lewis, because digitalization has its problems, yes, but what Lewis has put out is absolutely clear. And it's incontrovertible that you have, first, infrastructural problems. Second, can you imagine, we talked about 10 by 10 and 10 people in them. In that kind of atmosphere, you cannot really have education for anybody under any circumstance. Let us hope for the best, and let us hope things come back to normal, so that digitalization will be an kind of appendix to the main thing. As an appendix is a damn good thing to have, but not as the main kind of instrument of learning. And I do hope that it will not come to that. But the other thing is, this is going back to Nagma, and that is this, that in my experience in villages, when I talk to women and ask them what would they like for the future, almost all of them, by almost all I mean roughly 80% or so, say that we want a school. When I talk to men, almost 80% say we want a factory. I think they're saying the same things in different words, but the difference is very important. And if men begin to come back to the village, I wonder if they'll dilute the emphasis that women put on education. Because I really feel that women have given the young a much better chance at a future than the men have. And I'm not saying this because of being socially advanced or whatever, but this seems to me to be the way it appears on the ground. The other thing, which I again go back to Lewis, you see, when you're talking about working from home, we had the problem with digitalization of education we talked about. But remember, working from home is okay for people like us. In Dharavi, when you work from home, you're working for a supply chain. If the supply chain is not there, you're not working at home. You see, people don't work at home. Their home for most people is not where they live. Home for most people is where they work and where they sleep. They don't live there. They live outside on the streets. They work sometimes. For example, Dharavi is in the news every day. Dharavi, you'll find in every other home, perhaps, there's some kind of work going on. But that work cannot be there now. So you cannot work from home now in poorer places. You can work from home when you're an intellectual, when you're in the IT service, when you're in, whatever, middle-class job. But you cannot work from home under these circumstances today if you belong to the lower sector of society.
So for those who are listening in, Dipankar just mentioned Dharavi. Dharavi is the largest slum in Asia, which is in Mumbai. So most of the slums in India really not even are not only workplaces. They're also places where most of them carry out their livelihood activities, and hence it is difficult to move slum people into better housing, simply because their livelihood is where they are now. But anyway,
which is why many of the town planners are talking about in situ development of slums.
That's right, and then that's the right, but we'll not get into that at the moment. But I want to ask another slightly sensitive question, right? Especially because Dipankar has already talked about one leader of the party. Much of what we have seen over the lockdown experience.
One leader of all parties. Of all parties.
But that essentially means that the democracy within every party is comes into question. The reason why I raise this point is because, well, Nagba mentioned that the villages have organized themselves better since they had some time before the people started coming back, etc. The Dipankar talked about the RWAs being wielding lathis, right? Or dandas, which are essentially sticks to beat up people with, right? So all these things we are talking about. And in a federal structure, we saw the lockdown being announced centrally rather than states doing it, which is, today Sweden could have a different plan compared to other countries in Europe because, they were free to have their own plan. Whereas our states, even though we are a highly federal structure, did not have that because there was one law which allowed the central government to take it over. So in that context, have we learned anything from this in terms of decentralization, the third tier of government, which we have been talking about a lot, right? And yet they do not have the power or the authority to do many of the things that they could have done, as the pandemic has shown. If anybody wants to start.
Can I just come in very quickly?
Yes, please.
First of all, we must remember that India is not a federation, it is a union of states. It's not a federation really. We'll also remember that when the constitution was being framed, this point was discussed at great length, and it was found that because, right or wrong, that's a different matter, but it was believed that because India was a country faced by many challenges, the center has to be much stronger than in most other federal states. So in India, the domination of the center has always been there and accepted, even as we make token gestures towards federalism and state power. You'll find that over a period of time, the local governments in India have become more or less redundant. They don't work. They have no money, they have no power.
But do they not work because they have no power over finance? Because they have to depend on finance from whatever the state capital or center is giving.
Exactly. And there is no real pressure on them, on the center, to give more to the states, because the upbringing that we have politically is the center is very important, and everything else follows from that.
So you're saying you don't expect any change in that regard after this experience?
No, there should be a change, no doubt about it. But once you're in the center, you don't want to give up that power. You must remember that as well.
No, you can't do this, Dipankar. I'm asking you specifically, will there be change? Not whether there should be change. I'm asking you, will there be change?
I don't think so.
Nagma?
I don't think so.
Louis?
I don't think so, which is surprising given the fact that we've got a prime minister who was a very successful chief minister for a long time and understood the challenges the chief minister has. So I think we're all on the same side, Shubhashis. I don't know what side you're on, but we're all together.
Okay, now I'm on the side of the person asking questions. I'm not supposed to be
That's a good side.
but now I want to ask you we have little time, so if you can quicken up the process a bit, please. I want to ask you a question. What do you think will the government do because of its learnings? Because this was a crisis which was a real shock, right? Nobody expected it. So it's a good time to take stock. And what needs to be changed, either in the policy approach or in the policy themselves, implementation, what have you?
Okay, let me jump in over here and come back to a point that the Dipankar mentioned earlier about the strong man. So when the lockdown was announced, the prime minister went out and said, "This is what I'm doing," and he's a great, very eloquent speaker, and he got everyone back inside and concerned about the lockdown. There were people here and there who misbehaved, but by and large, he got that fear into people. But now that fear has reached such a state where we've talked about earlier that people don't want outsiders to come back into their territory. Villagers don't want outsiders. Building societies don't want outsiders. So that fear has made everyone wary about dealing with each other. So how do you unlock that fear and make people interact with each other again? And now we're seeing a situation where politically no one wants to take that call that I was responsible for delocking the country or unlocking the country if there is a second sort of, surge of illnesses coming place. So today we're seeing a collective decision being taken where the prime minister is talking to the chief ministers of different places. And I presume, from where I'm sitting, that part of it is diffuse the responsibility of this. Now, if this can be something which is longer lasting and leading to more decentralization of some decisions, maybe it will, come back to your earlier question, be something which will be long lasting, or is it just going to be a little flash for this time because of the risk of decision making, and we'll go back to a centralized thing later?
The reason why I asked the question is because I'm really not that cynical. Like the three of you said, it will not happen, right? I'm a little bit more optimistic, and I'll tell you why. Because look at the newspaper reports today on Kerala. There were about 40 to 50,000 migrant workers from Assam, and none of them want to leave because the police, the local government, and the MSMEs where they work, right? They have all stood by their side, given them salaries, asked them to stay back, taken care of their food and families back home. This has been done by the local government, right? Because only the local council, and Kerala has very, very strong local government, right, compared to other parts of the country. So shouldn't we learn from this? Here is an example that has happened within India.
But listen, Shubhashis, Kerala wasn't born yesterday. It's been there for many, many years, and we haven't learned. What Kerala has done now is not doing it for the first time.
That's
Kerala
right.
has been doing it for 70 years, and we haven't learned from it. I went to Kerala about 7 or 8 months after that devastating flood. And you must believe me, I didn't see a sign of it. They had completely taken Kerala to back where it was before the flood. 7 or 8 months after that flood, there was no sign of it. In Kerala, boatmen came out and helped everybody and said, we don't want to be paid. In Kerala, people from the Middle East elsewhere came and said, we are going to set up internet hubs. Kerala is different. Don't talk with Kerala in your mind. Kerala is an exception to the rule. And Kerala, therefore, tests the rule. Doesn't prove the rule, it tests it. And the rule is being tested. So therefore, you can say, if Kerala can do it, why can't the rest of India?
That's
which
right.
I will say, if Kerala has died for 70 years, why haven't we done it for 70 years? Answer that question.
It is because I don't think we talk about this well enough or enough.
Because there are many vested interests.
I'll tell you what, I'll go back to what you yourself said, that invariably such discussions become demand, supply, monetary, fiscal. Right? The fact that it's the organization of society in Kerala, which is very different from organizational, that we never talk about. So why can't we all sitting here agreeing to this?
Because
why can't we go out and talk about it all the time?
I would love to talk about it all the time, but I talk to deaf ears. In
But
Kerala,
I'm the one who brought up the Kerala example. And
exactly.
the fact of the discussion.
And we just hope that you'll be the leader of the future.
No, we want many leaders, not one leader.
No, but Shubhashis, those communities, so in across India, the places where communities have been able to respond are when there was a sense, there's a micro Kerala happening there, where there's a community bonding between people, communities are standing up, members are standing up each other, but most importantly, there is accountability of the local governance systems to respond. And where citizens have been able to, in all this grief and in all this fear, where citizens have been made able to form small bodies which think about everyone, which also talk to the local government institutions to ensure that, PDS systems are working, or, Jandan accounts are being accessed, or ration card, or the lapses in ration cards are being filled by temporary ration cards. Wherever accountability and access to government systems has been possible by citizens is when this has worked. And it has worked in pockets of this country, but many places it is not.
So Nagma, if I can just, if I can just stop you there. You work with civil societies, right? So why can't you say that civil societies will learn from this and therefore take on the role that you're talking about?
Absolutely. No, so we are doing that at our levels. In fact, wherever these examples are there, we are evangelizing it. But one has to understand that accountability works with a very powerful citizenship plus civil society organization movements, where they're also holding local governments to to account that if grains have come, why are they not being distributed? But in a lot of places, vested interests don't allow that seamless confidence to be built. Most places it fails because citizens are too scared to come together, or are too mistrusting of each other. We have seen so many good cases of community participation, but we've all also seen very, very strong cases of neighbors distrusting neighbors. People who've returned from hospitals not being allowed to enter their own societies. There is suspicion, and that kills community participation. So if we are able to...
So then let me ask a question to everybody in the little time that I have, right? So what will change? You are saying that we will wait for 2, 3, 4 years for the recession to work itself out, etc., and then we will be back to pre-25th March lockdown phase, right? So what will change? You're saying that nothing will change?
Well, okay, go ahead, Dipankar.
No, you don't, Louis, you start. I'll follow you.
So I think there is hope that we will see change because of whatever's happening. The fact that today we have 300 million people who have bank accounts, they didn't have it 5 years back. Those things, those bank accounts being activated when the government transfers money into them. Will there be, for example, the Chief Minister of Haryana, which is one of the northern states, wrote to the Chief Minister of Bihar, which is the state where a lot of the labor came from, and wrote to him and said, "We will look after your people. For us, all Indians are the same." So things like that are happening. But now the question is, how do we keep that momentum going on so that when 3 years later, 4 years later, we don't slip back to business as usual? This is an interesting time for us to change. And actually, as Nagma said, this is the time when civil society also has to put in. The government, for example, today acknowledges the role of the non-profit sector in significant ways in the aid. How do we make sure this is not forgotten 4 years later?
Dipankar?
I was just going to say, as my old hobby horse, that a lot depends upon leadership. And I think if we are able to, somehow create the leadership that is responsive to people, only then will people also respond. People don't take the first step. People always respond to leadership. So political leaders must first act so that people will then react. And you will find that this kind of citizenship participation is usually quite prominent in societies where the leadership is upfront and is working hard and taking decisions suo moto on behalf of citizens. So I was told once by a very prominent politician, not in India, of course, that anybody who says that he or she is doing something because he or she has learned from the people or is hearing from the people is a liar. A leader should do what the leader thinks is correct and then let people judge the leader at election time.
That's a very, very clear point. Yes, Nagma, anything to add about what you think will change? Or why will we not change?
No, I think there is a very this is that time in our lives where there is a huge possibility of change. But I feel apart from leadership, which Dipankar highlighted, there are two other things that will cause change if we get them right. One is accountability. So with good leaders, also good accountability framework where citizens can ask questions and also go to people and pull them up for not doing their jobs or to demand what is owed due to them. If citizens fall into that habit, because the one thing that has begun now is a bit of a fatigue in citizens and going to public offices and saying, where is my ration, has begun. So using that real model to say, the accountability of my local corporator, local government, my CM is very, it is important. So I feel accountability is very important here. The other is technology. Not from simple education, but also the messaging that spreads across the society. In the Indian framework, there is a very creative...
Nagma, I'm going to stop you now because we're running out of time. So in 5 seconds, if you have to say anything, please.
No. I will just say wrap up with third thing would be technology. That's it. Thank
Technology.
you.
Okay, thank you very much. Thank you very, very much, all you panelists. It has been quite, vibrant. I like the discussions. Many of the things came out. There was a little bit of depression at the beginning about things that were going wrong, but very soon you got into thinking that things might actually change with a little bit of prodding from me. But I would like to thank you and Gothenburg University for giving us this opportunity, and all the audience and participants who sat through this webinar. Have a nice day. Keep healthy, or as we say in India, stay negative. Thank you and bye.
Thank you.
Thank you.
Yeah. Bye.